Rheumatoid arthritis typically presents with what type of deformity in the distal joints of the fingers? A. Shepherd's crook deformity. B. Heberden node. C. Swan neck deformity. D. Pencil in cup deformity. The answer is C. Swan neck deformity. Swan neck deformity is often seen in patients with rheumatoid arthritis. This is a state in which the distal interphalangeal joint, dip, becomes hyperflexed, bends toward the palm, while the proximal interphalangeal joint, pip, is hyperextended, bending away from the palm. Shepherd's crook deformity is seen in Paget's disease of the bone, pencil in cup deformity is seen in psoriatic arthritis, and Heberden nodes are frequently seen in the distal phalanges of patients with osteoarthritis. What is the most common form of muscular dystrophy? A. Emery-Dreifuss. B. Duchenne. C. Becker. D. Myotonic. The answer is B. Duchenne. Duchenne's is the most common and most severe form of muscular dystrophy, accounting for a full 50% of cases of muscular dystrophy in the U.S. The next most common type is Becker's, followed by myotonic muscular dystrophy and Emery-Dreifuss. Which of the following conditions is associated with autoantibodies to presynaptic calcium channels? A. Myasthenia gravis. B. Lambert-Eaton syndrome. C. Dermatomyositis. D. Multiple sclerosis. The answer is B. Lambert-Eaton syndrome. Lambert-Eaton syndrome is a condition of progressive muscle weakness caused by an autoantibodies to presynaptic calcium channels in the neuromuscular junction. This does not allow calcium to enter the presynaptic cell, which is required for neurotransmitter release into the synaptic cleft. Without the release of neurotransmitter, there will be no muscular response. Myasthenia gravis is an autoimmune condition in which antibodies are formed against acetylcholine receptors, and muscular weakness in multiple sclerosis is caused by destruction of myelin in the CNS due to antibodies against oligodendrocytes. Dermatomyositis is an inflammatory connective tissue condition that may be associated with a post-viral autoimmune reaction or triggered by a perineoplastic syndrome. What are the classic histological findings of dermatomyositis? A. Fibrous muscle fibers and fatty infiltrates. B. Parafascicular muscle fiber atrophy and fatty infiltrates. C. Granulomas and necrotic muscle fibers. D. Mixed B-cell and T-cell paravascular inflammatory infiltrate and parafascicular muscle fiber atrophy. The answer is D. Mixed B-cell and T-cell paravascular inflammatory infiltrate and parafascicular muscle fiber atrophy. Histological findings of dermatomyositis will generally reveal mixed B-cell and T-cell paravascular inflammatory infiltrate and parafascicular muscle fiber atrophy. Fibrous muscle fibers and fatty infiltrates are typical of Duchenne's muscular dystrophy, while granulomas in muscle are rare but may be seen in sarcoidosis and other conditions of granulomatous myositis. 90% of adult rhabdomomas are located in what area? A. The calf. B. The upper arm. C. The lower back. D. The neck. The answer is D. The neck. A rhabdomoma is a benign tumors of striated muscle. 90% of adult rhabdomomas present as round masses in the neck.